This is Dr. Russell Blaylock, and you're listening to the Blaylock Health Channel. Today, what I'm going to talk about is vitamin C. Hope to go through some of the things that maybe you're not aware of about vitamin C. I tend to call vitamins and natural products things that come from God's pharmacy. Now, most of us know that vitamin C has something to do with collagen strength. It fights viral infections, and it prevents scurvy. Those things are pretty well known. And as a product that the body uses, metabolic product that it uses to strengthen collagen tissue, that is the connective tissue cement in the body, it protects the skin. If you watch the aging process occur, you see that the skin begins to sag, it loses some of its strength, it becomes thin, and this is because of the gradual loss of vitamin C and collagen in the elderly. And you also see some skin hemorrhages, and these are the little capillary vessels, the small vessels that break, and there's hemorrhages up underneath this very thin skin. As a product that increases collagen strength, is very important in blood vessels. Blood vessels have to be pretty strong to take the sudden rush of blood that comes out of the heart under very high pressure. And the elasticity of the vessel allows it to dilate slightly, and then that keeps the pressure at a consistent level so that it doesn't suddenly get really high and then get very low. So the elasticity has more to do with other products, but the strength of the vessel has to do with the collagen and vitamin C. Because the connective tissue throughout your body is holding all the organs and tissues together, keeps the cells where they are supposed to be. It's also important in protecting against invasion by infectious processes, for instance, bacteria that's trying to get through the skin, or if you have an infection deep in the skin, that barrier of collagen tries to keep it from spreading. The same thing happens with tumors, cancerous invasion. This collagen is trying to prevent it from penetrating deeper into the body and eventually metastasizing. Now, one of the conditions we see with weakened blood vessels is called aneurysms, and this is an area on the vessel that becomes very weak. It dilates, and eventually it can rupture. You can have aneurysms in numerous blood vessels throughout the body, all the way from the largest blood vessel, which would be the aorta, to mainly blood vessels in the brain that feed the brain. As a neurosurgeon, I treated a number of aneurysms. When these rupture in the brain, of course, it can destroy brain tissue and produce rapid death. So strength of these blood vessels is very important. One of the things we find that vitamin C is important is in controlling stress. Now, one of the highest levels of vitamin C in the body is in the adrenal glands, and it plays a part in the formation of some of the adrenal hormones, primarily epinephrine and norepinephrine. It also has some actions in the brain, in a particular nucleus in the brain called the amygdala, and that's regulatory for anxiety and helps prevent anxiety. So vitamin C is often called the stress vitamin. And under intense stress, our vitamin C level tends to deplete very quickly. So it's very important for stress to produce these stress hormones, hormones that are needed to control stress. Most of us know it's an antioxidant. It's a water-soluble substance, which means that it's in the watery parts of the cell. The fatty membranes, most of the membranes, the nuclear membrane, the mitochondrial membrane, and the membrane of the cell itself is made of layers of a fatty material. So vitamin C cannot penetrate that because it's water-soluble. But it's there at the interface between the watery parts of the cell and that fat, so it helps protect it as well. In order to get into the cell, it has a special carrier to get inside of the cell. Now, there are water-soluble forms of vitamin C, ascorbate, magnesium ascorbate, calcium ascorbate, and ascorbic acid. But there are also some formulations that are fat-soluble. One of them has the fatty acid palmitate combined with ascorbate, and it's fat soluble, so it'll go through the fatty parts of the cell. And there's another called the lipospheric ascorbic acid, which is encased in a phospholipid. It also will penetrate the fatty parts of cells, so it can protect both the watery parts and the fat parts of cell. And that's very important that you get this biphasic protection of the cell. Now, one of the things that produces very high levels of free radicals in the body is iron and copper. These two ions are very, very powerful catalysts for the production of what we call reactive oxygen species, or free radicals, and lipid peroxidation products, which are fats that become oxidized, which are very harmful to the cells and tissues. Now, one of the problems with ascorbate, or vitamin C, is that it dramatically increases the absorption of iron. So that if you're eating a meal that has iron in the food, for instance, in your vegetables, spinach has a fair amount of iron, normally that iron is not absorbed because of the flavonoids in spinach bind the iron so that you don't absorb it. So eating spinach is not a good source of iron. But if you add vitamin C to that, then it will free the iron and it'll be absorbed. So based on that, you never want to take vitamin C with your meals. You want to take it between meals, because one of the problems we have, particularly as you get older, is excess iron absorption, and high iron levels in the body is associated with a great number of diseases, including cancer and degenerative diseases of the brain. So you want to be sure and take your vitamin C supplements between meals. You also don't want to use iron cookware, skillets, or copper-coated cookware, because that leaches out into the food and will produce high levels of free radicals. Now, another function of vitamin C that a lot of people are not aware of is that it plays a major role in brain development during the infant's brain development in utero, that is, inside of the uterus. During the third trimester of the baby's development is a very intense brain formation period. And after birth, there's a very intense brain formation. And what we've learned is that inside of the brain has the highest vitamin C level in the entire body. And within the brain, the hippocampus, which is the memory and emotional areas of the brain, has the highest content of vitamin C in the brain itself. So the brain is a very vitamin C concentrated organ. There's also high levels in this nucleus I talked about before, the amygdala, which has to do with stress, primarily fear reactions and emotional reactions to various things. Now, one of the studies that was done, they used guinea pigs, because guinea pigs, unlike most animals, cannot make vitamin C. Humans can't make vitamin C either, so they used the guinea pigs so it's closer to the humans. And what they found is if you induce a vitamin C deficiency during pregnancy, there was abnormal development of the hippocampus of the brain in that offspring, that baby. And if you try to give the vitamin C after the baby's born, you can't correct that damage. So keeping the vitamin C elevated during pregnancy is important. You don't want too much vitamin C. Usually about 200, 250 milligrams of vitamin C as a pregnancy supplement would be good, a multivitamin mineral. One of the other surprising things about vitamin C is that it has a very powerful antidepressant effect. Now, in the brain, you have neurotransmitters, which are chemicals that allow the various cells in the brain to communicate. One of the most abundant of these neurotransmitters is glutamate, and it's also one of the most toxic, so it's very carefully regulated. And what we know is when nerve cells, when these communication lines start communicating, when they release glutamate, at the very same time they release vitamin C in the brain. And that's to protect the cells against damage by the glutamate itself. Now, the reason I took time to introduce you to that is the fact that now we know that depression is due to excess glutamate, this excitotoxic amino acid in the brain. And so when people have low level of vitamin C, they have a greater incidence of depression. And higher levels of vitamin C can overcome a lot of depression. In fact, one study found that it was just as effective as a prescription antidepressant when the levels were elevated. We also have learned that deficiencies in vitamin C in newborn animals increases their level of anxiety to amphetamines later in life. So if the baby's deficient in vitamin C later in life, that is when they're a teenager or a young person, they have much greater harmful effect in terms of anxiety from amphetamines than would a person with good vitamin C nurture. So it's increasing the sensitivity to anxiety. So this is something to keep in mind. The other thing is that vitamin C plays a major role in a couple of other neurotransmitters in the brain, norepinephrine and dopamine. Now, dopamine has to do with elevating our mood, learning, and motor control, because deficiencies in dopamine are associated with Parkinson's disease. Norepinephrine, that neurotransmitter, is associated with learning and attention, so it's very important in learning. So if you're deficient in vitamin C, it could interfere with your mood, your learning ability, and your attention. And we know that deficiencies in certain vitamins, like vitamin C and vitamin E, can increase the amount of free radicals in the brain and increase lipid peroxidation in the brain. So that's an important thing to keep in mind. Now, with that bit of information, of course, the next thing a person would be interested in is it related to Alzheimer's disease? And they did several studies on Alzheimer's disease, and what they found out is that people with Alzheimer's have lower spinal fluid vitamin C levels than normal people. And this ratio between the spinal fluid vitamin C and the blood vitamin C is very important, and it's mainly they're losing their brain vitamin C concentration. One of the functions of vitamin C is to maintain the blood-brain barrier, and that is a special vascular barrier that protects the brain against things that are in your bloodstream. And as we age, that barrier becomes damaged, and vitamin C is very important in maintaining it. It's also been found that vitamin C in experimental animals that have an Alzheimer's-like pathology, that the vitamin C will reduce the beta amyloid oligomers, which are the ones that most associated with Alzheimer's pathology. It reduces them when you raise the vitamin C level. So vitamin C is very protective of the brain. Based on this same idea, and they looked at stroke victims and found out that, in fact, if you took animals and you made a stroke in the animal, the ones that had high vitamin C intake had far less damage to their brains than those that didn't take the vitamin C. So vitamin C is very protective against brain damage associated with strokes and reduces the incidence of strokes as well. And the same goes for head injuries. It reduces the damage done in a head injury. Now, one of the things we know is that older brains are at a greater risk than younger brains, and that's because they have lower levels of antioxidant enzymes, and as you age, you have higher levels of inflammation throughout the body, including the brain, and therefore higher levels of free radical accumulation. And therefore, you need higher levels of these antioxidant vitamins, including vitamin C. And vitamin C has been shown to reduce seizures. People who have problems with seizures, particularly controlling seizures with the typical medications, adding high doses of vitamin C can reduce their seizures. And one of the really interesting things that vitamin C does, it has to do with pain. High levels of vitamin C tend to reduce pain, particularly chronic pain. And one of the most difficult chronic pains is called complex pain syndrome. That's associated with fractures. People will fracture a bone, say, in their lower leg or the ankle or their wrist, and they'll develop this chronic, intense pain that doesn't seem to respond to the usual pain medications. What they discovered was that if you gave people who fractured a bone high levels of vitamin C, the incidence of this complex pain syndrome will reduce considerably. In one study, they looked at 416 people who had fractures, and 10% of those normally would develop complex pain syndrome. But those that got the vitamin C supplementation overall only had a 2.4% incidence of this terrible pain. So that was a tremendous reduction in this incidence of this painful condition, almost a 5-fold reduction. And those who took the highest dose of vitamin C, which was about 1,500 milligrams a day, it was reduced down to 1.7% had the complex pain syndrome. So 1.7% versus the 10% that occurs in people without the vitamin C, that's quite impressive. And one of the other interesting effects of vitamin C, it protects us against pesticide toxicity. Now, pesticides are virtually everywhere. There's no place on earth you're protected against pesticides. They're in the air, they're in the water, they're in the plants you eat. So all of us have pesticides in our bodies. It's been shown to be particularly protective against some common types of pesticides like lindane and chlorpyrifos. Another really interesting effect of vitamin C is its ability to protect the heart. We normally don't think of vitamin C as being heart protective. Not only does it reduce the incidence of atherosclerosis and has a rather profound effect on preventing atherosclerosis, but it also reduces things like strokes and heart attack risk. And in one randomized multi-center study where they took information from a lot of different hospitals, including over 800 patients who had had a heart attack, and they found that those that they gave intravenous vitamin C to, as well as oral vitamin C for 30 days after their heart attack, those patients had far less risk of developing heart failure, recurrent heart attacks, and death than those who just had the conventional care. In another study, they found that combining vitamin C and vitamin E reduced heart attacks from 14% to 8% in diabetic patients. And of course, diabetic patients are at the highest risk of having heart attacks. So this is a considerable effect of the vitamin C. Now, in this study, they've combined vitamin C and E, and I try to emphasize in all my writings and lectures the importance of the antioxidant network. And that is, antioxidants work together. You don't just take one. So you take vitamin C and vitamin E, and they complement each other. Vitamin E restores vitamin C's antioxidant capacity. And beta-carotene and the magnesium, the tocopherols, tocotrienols, all of these interact to increase your protection against free radicals and lipid peroxidation. So it's important to take multiple types of antioxidants, including the flavonoids, like curcumin and quercetin and ellagic acid. All of these interact to greatly boost the antioxidant capacity involved. Now, what you've learned in this podcast is that vitamin C is much more than just an antioxidant or for viral illnesses or collagen. It has beneficial effects on virtually every tissue and organ in the body, including blood vessels, the heart, the nervous system, plays a major role in brain development, and deficiencies and insufficiencies of vitamin C are quite common, especially among the elderly and chronically ill people. And these deficiencies in vitamin C can develop quite rapidly, particularly with severe stress, trauma, surgical procedures, and with infections. I used to treat a lot of trauma patients, and we know in trauma, the water-soluble vitamins like vitamin C and the B vitamins can disappear within a matter of hours, so that by 24 hours you can have severe deficiencies. So it's important that you supply yourself with these antioxidant mixtures every day on a regular basis, and they're because you don't plan trauma. So if you're in a car accident or something and you're taking your antioxidant network, you'll be much better protected, or if you should have a stroke, you're much better protected if you do that. If you enjoyed listening to this week's podcast and would like to hear previous episodes of the Blaylock Health Channel, go to our website at www.blaylockhealthchannel.com. Thank you. The information contained within these programs is not intended to replace or contradict that of your physician. This information is for educational purposes only.